Dementia. As a person ages, some of the ability to think logically and clearly may be lost. This ability is called cognition. When some of this ability is lost, a person is said to have cognitive impairment that affects concentration and memory. Dementia is a general term that refers to a serious loss of mental abilities, such as thinking, remembering, reasoning and communicating. As dementia advances, these losses make it difficult to perform activities of daily living, such as eating, bathing, dressing and eliminating. Social skills may be affected. Dementia is not a normal part of aging. Normal changes of aging include the following: some loss of cognition affecting memory and concentration, slower reaction time, difficulty finding or using the right words, sleeping less, being more wakeful. No. Common causes of dementia include the following: Alzheimer's disease, multi-infarct or vascular dementia, a series of strokes causing damage to the brain. Lewy body dementia, abnormal structures, called Lewy bodies, develop in areas of the brain, causing a variety of symptoms. Parkinson's disease, Huntington's disease, an inherited disease that causes certain nerve cells in the brain to waste away. Important things to remember about dementia. Adult dementia sufferers deserve the respect and status they have earned. They often do not know their abilities have changed and do not understand why people treat them differently. They must be given as many opportunities as possible to make decisions and retain control over their lives. With the right environment and support, the patient's ability to function can be strengthened and improved. If those supports are removed, the patient's function will decline. The deficiencies caused by dementia affect all aspects of the patient's life. Although the disability is invisible, it affects the patient's ability to do even the smallest activities of daily living. The way a patient with dementia behaves is not just the result of impaired brain function. Behavior is often caused by efforts to meet needs, while compensating for lost abilities. As in H, you can help patients with dementia by trying to understand what they feel and think. No. How dementia affects patients' function. 1. Memory loss. Dementia affects recent memories the most. Dementia makes it difficult to learn anything new or to follow instructions. 2. Language loss, the meaning of words. Dementia makes it difficult to recognize words and understand complex sentences. Dementia makes it difficult to express ideas. 3. Attention loss. Patients with dementia are unable to start or stop a task. Patients with dementia get easily distracted. 4. Judgment loss. Patients with dementia cannot accurately assess circumstances. Patients with dementia are unable to see consequences of actions. 5. Loss of perception or senses. Patients with dementia are unable to recognize things or people. Patients with dementia misinterpret what they see, hear or feel. 6. Loss of muscle organization. Patients with dementia are unable to perform multiple-step tasks. Patients with dementia require prompts or cues for routine tasks. Tips for communicating with a patient with dementia. Always be open, friendly and gentle. Always address the patient by name to get his or her attention at the beginning of interaction. Give your full attention to conversation or task. It helps the patient stay focused. Briefly introduce yourself and offer some cues when you approach, stating your name and relationship and the purpose of your visit. Speak slowly, but do not speak down. Use gentle touching or hand-holding but get permission first. Avoid arguing or attempts to reason with the patient who is upset. Acknowledge his or her feelings and calmly distract him or her with something calming, friendly and pleasant. Ways to help a patient with dementia perform a task. 1. Explain each step to the patient in simple language, one thing at a time. 2. Demonstrate each step, doing the task while he or she watches. 3. Move the patient through the steps of the task, placing arms and legs in the right positions. 4. If distracted, start again from the beginning. Remember to be patient and unhurried. Define the following terms. Alzheimer's disease. A progressive, degenerative and irreversible disease that causes tangled nerve fibers and protein deposits to form in the brain, eventually leading to dementia. Progressive. Something that continually deteriorates. Degenerative. Something that continually gets worse, causing greater and greater loss of health and abilities. Irreversible. Means that the disease cannot be cured. Patients with Alzheimer's disease will never recover. They will need more care as the disease progresses. Alzheimer's disease. Facts about Alzheimer's disease. Symptoms of Alzheimer's disease appear gradually. It generally begins with memory loss. As the disease progresses, it causes greater and greater loss of health and abilities. Patients with Alzheimer's disease may get disoriented. They may be confused about time and place. Communication problems are common. Patients may lose their ability to read, write, speak or understand. Skills that a patient has used constantly over a long lifetime are usually kept longer. Mood and behavior changes. Aggressiveness, wandering and withdrawal are all part of Alzheimer's disease. Alzheimer's disease generally progresses in stages from mild to moderate and severe state of illness. In each stage, the symptoms of the disease become progressively worse. Most patients, eventually, become completely dependent on others for care. It is important for home health aides to encourage independence, regardless of signs and symptoms a patient with Alzheimer's disease shows. The patient should be encouraged to do whatever he or she is able to do. It helps keep the patient's mind and body as active as possible. Working, socializing, reading, problem-solving and exercising should all be encouraged. Having all patients do as much as possible for themselves may even help slow the progression of the disease. The following attitudes will help us give the best possible care to patients with Alzheimer's disease. 1. Do not take things personally. Alzheimer's disease is a devastating mental and physical disorder. It affects everyone who surrounds and cares for the patient with Alzheimer's disease. Patients with Alzheimer's disease do not have control over their words and actions. They may often be unaware of what they do and say to others. They may not recognize a caregiver. They may ignore, accuse or insult the care team members. When it happens, it is important to remember that the behavior is due to the disease. Facts about Alzheimer's disease. No. 2. Be empathetic. HUS should assume that patients with Alzheimer's disease have insight and are aware of the changes in their abilities. HUS should treat these patients with dignity and respect. 3. Work with the symptoms and behaviors noted. Each patient with Alzheimer's disease is an individual. Patients with Alzheimer's disease will not all show the same symptoms at the same times. Each patient will do some things that others will never do. The best strategy is to work with the behaviors that are seen on a particular day. For example, a patient with Alzheimer's disease may want to go for a walk one day, when the day before he or she did not want to go to the bathroom without help. If allowed by the care plan, the HUS should try to go for a walk with the patient. 4. Work as a team. When HUS observe and report carefully, the care team may be better able to develop solutions. HUS are in a great position to give details about patients. Being with patients often allows them to be experts on each case. HUS should make the most of this opportunity. Facts about Alzheimer's disease. No. 5. Be aware of difficulties associated with caregiving. Caring for someone with dementia can be physically and emotionally exhausting, as well as incredibly stressful. Home health aides should take care of themselves, so they can continue to provide the best care. Being aware of the body's signals to slow down, rest or eat better is important. Unmanaged stress can cause physical and emotional problems. When stress feels overwhelming, Anna should talk to his or her supervisor in the agency. 6. Work with family members. Family members can help us learn more about a patient. They also provide familiarity and comfort to the patient with Alzheimer's disease. We should build relationships with family members and keep the lines of communication open. In addition, we should be reassuring to family members. It is very difficult for families to see a loved one's health and abilities decline. When patients with Alzheimer's disease exhibit problem behaviors, it can be stressful for the family. HUS can help by reassuring family members that they understand that this behavior is part of the disease. Facts about Alzheimer's disease. No. HUS can use these guidelines when communicating with patients with Alzheimer's disease. Always approach from the front and do not startle the patient. Smile and look happy to see the patient. Be friendly. Determine how close the patient wants you to be. Communicate in a calm place with little background noise and distraction. Always identify yourself and use the patient's name during the conversation. Speak slowly, using a lower tone of voice than normal. This calming and easier to understand. Repeat yourself, using the same words and phrases, as often as needed. Use signs, pictures, gestures or written words to help communicate. Break complex tasks into smaller, simpler ones. Give simple, step-by-step instructions if necessary. If the patient is frightened or anxious, speak slowly in a low, calm voice. Speak in a quiet area with few distractions. Try to see and hear yourself as they might. Always describe what you are going to do. Use simple words and short sentences. If helping with care, list steps one at a time. Check your body language. Make sure you are not tense or hurried. Communication techniques for specific situations with patients with Alzheimer's disease. If the patient forgets or shows memory loss, repeat yourself, using the same words, if you need to repeat an instruction or question. However, you may be using a word the patient does not understand, such as tired. Try other words like nap, lie down, rest, etc. Repetition can be soothing for a patient with Alzheimer's disease. Many patients with Alzheimer's disease will repeat words, phrases, questions or actions. This is called perseveration. If your patient perseveres, do not try to stop him or her. Answer the questions, using the same words each time, until he or she stops. Even though responding over and over may frustrate you, it communicates comfort and security to the patient. Keep messages simple. Break complex tasks into smaller, simpler ones. Communication techniques for specific situations with patients with Alzheimer's disease. If the patient has trouble finding words or names, suggest a word that sounds correct. If this upsets the patient, learn from it. Try not to correct the patient who uses an incorrect word. As words written and spoken become more difficult, smiling, touching or hugging can help show care and concern. Remember, however, that some patients find touch frightening or unwelcome. If the patient wants to say something but cannot, encourage the patient to point, gesture or act it out. If the patient is obviously upset but cannot explain why, offer comfort with a smile or try to distract him or her. Verbal communication may be frustrating. If the patient is verbally abusive or uses bad language, remember it is the dementia speaking, not the person. Try to ignore the language and redirect attention to something else. Communication techniques for specific situations with patients with Alzheimer's disease. If the patient seems not to understand basic instructions or questions, ask the patient to repeat your words. Use short words and sentences, allowing time to answer. Note the communication methods that are effective and use them. Watch for nonverbal cues as the ability to talk lessens. Observe body language, face, hands, etc. Use signs, pictures, gestures or written words. For example, a picture of a toilet on the bathroom door reminds a patient where the bathroom is. Combining verbal and nonverbal communication is helpful. For example, you can say, "Let's get dressed now," while holding up clothes. If the patient does not remember how to perform basic tasks, break each activity into simple steps. For instance, "Let's go for a walk." Stand up. Put on your sweater. First, the right arm. Always encourage patients to do what they can. Communication techniques for specific situations with patients with Alzheimer's disease. If the patient insists on doing something that is unsafe or not allowed, redirect activities towards something else. Try to limit the times you say "don't." If the patient hallucinates, sees or hears things that are not really happening, is paranoid or accusing, try not to take it personally. Try to redirect behavior or ignore it. Because attention span is limited, this behavior often passes quickly. If the patient is depressed or lonely, take time, one-on-one, to ask how he is feeling. Really listen. Try to involve the patient in activities. Always report signs of depression to your supervisor. Communication techniques for specific situations with patients with Alzheimer's disease. If the patient has lost most verbal skills, use nonverbal skills. As speaking abilities decline, patients with Alzheimer's disease will still understand touch, smiles and laughter for much longer. Remember that some people do not like to be touched. Approach touching slowly. Be gentle. Softly touch the patient's hand. A smile can communicate positivity and your willingness to help the patient. Even after verbal abilities are lost, signs, labels and gestures can reach patients with dementia. Assume patients with Alzheimer's disease can understand more than they can express. Do not talk about them as though they were not there or treat them like children. Communication techniques for specific situations with patients with Alzheimer's disease. 1. Develop a routine and stick to it. Being consistent is important for patients who are confused and get easily upset. 2. Promote self-care. Helping patients care for themselves as much as possible will help them cope with this difficult disease. 3. Take care of yourself, both mentally and physically. This will help you give the best care to patients. The following are general principles for providing personal care to patients with Alzheimer's disease. Interventions for problems with common activities of daily living (ADLs). As Alzheimer's disease worsens, patients will have trouble doing their activities of daily living. Intervention is a way to change an action or development that will help patients with the problems caused by Alzheimer's disease. If the patient has problems with bathing, schedule bathing when the patient is least agitated. Prepare the patient before bathing. Hand him or her the supplies, such as washcloth, soap, shampoo, towels, etc. Take a walk to the bathroom with the patient, rather than asking directly about the bath. Make sure bathroom is well lit and is at a comfortable temperature. Provide privacy during the bath. Be calm and quiet when bathing the patient. Be sensitive when talking to the patient about bathing. Give the patient a washcloth to hold. This can distract him or her while you finish the bath. Always ensure patient safety. Use non-slip mats, tub seats and handrails. Be flexible about bathing. The patient may not always be in the mood. Offer encouragement and praise to the patient. Let the patient do as much as possible during the bath. While bathing, check the skin for signs of irritation or a breakdown. No. Interventions for problems with common activities of daily living (ADLs). If the patient has problems with grooming and dressing, assist with grooming to help patients feel attractive and dignified. Avoid delays or interruptions while dressing. Provide privacy by closing doors and curtains. Show the patient some of his or her clothing. This brings up the idea of dressing. Encourage the patient to pick clothes to wear. Simplify this by giving just a few choices. Make sure the clothing is clean and appropriate. Lay out clothes in the order in which they are to be put on. Choose clothes that are simple to put on, such as slip-on instead of lace-up shoes and pants or skirts instead of dresses. Break the task down into simple steps. Introduce one step at a time. Do not rush the patient. Use a friendly, calm voice when speaking. Praise and encourage the patient at each step. Interventions for problems with common activities of daily living (ADLs). If the patient has problems with elimination, encourage fluids. Follow the patient's care plan for drinking fluids. Mark the bathroom with a sign or a picture as a reminder of where it is. Make sure there is enough light in the bathroom and on the way there. Note the times of the patient's incontinence. Check the patient every 30 minutes. Take the patient to the bathroom just before his or her bathroom time. Take the patient to the bathroom after drinking fluids. Make sure that the patient urinates before getting off the toilet. Take the patient to the bathroom before and after meal and before bedtime. Put lids on trash cans, wastebaskets or other containers if the patient urinates or defecates in them. Be professional when cleaning after episodes of incontinence. Do not show any disgust or irritation. If the patient has problems with nutrition, encourage nutritious food. Food may not interest a patient with Alzheimer's disease. He or she may also forget to eat, which puts the patient under risk for malnutrition. Serve meals at regular, consistent times each day. You may need to remind the patient that it is mealtime. Serve familiar foods that look and smell appetizing. Make sure there is adequate lighting. Keep noise low and distractions to a minimum during meals. Keep the task of eating simple. If the patient is restless, try smaller, more frequent meals. Finger foods that are easy to pick up with the fingers, work best. They may include sandwiches cut into fourths, small pieces of cooked boneless chicken, cheese cubes, halved hard-boiled eggs, fresh fruit or soft vegetables. Always follow diet instructions provided in the patient's care plan. Do not serve steaming or very hot foods. Use a simple place setting with a single eating utensil. Put only one item of food on the plate at a time. Give simple, clear instructions to the patient. Guide the patient through the meal. Feed slowly. Use adaptive equipment for eating, such as special spoons and bowls, as needed. Make mealtime simple and relaxed, not rushed. Observe and report eating or swallowing problems, as well as any changes in eating habits. Monitor the patient's weight. Interventions for problems with common activities of daily living (ADLs). Promote physical health. Prevent infections and follow standard precautions. Observe the patient's physical health and report problems. Help patients wash their hands frequently. Give careful skin care to prevent monitor for pain. Watch for signs of pain and report them to your supervisor. Maintain a daily exercise routine. Mental and emotional health. Maintain self-esteem by encouraging independence. Share in enjoyable activities. Reward positive and independent behavior with smiles and warm touches. HUS should know these points about safe environments for patients with Alzheimer's disease. A nurse should assess the home for safety. All safety measures suggested by the nurse should be implemented. Changes in the patient's health condition, especially in behavior, must be reported. Environment should be adapted as the need arises. The below guidelines are helpful in creating a safe environment for patients with Alzheimer's disease. For disoriented patients, use signs to mark rooms, including stop signs on rooms that should not be entered. Use calendars and other reminders of day, date and location. Put bells on the door to indicate when someone is coming or going. Keep pictures and familiar objects around. Put stickers or brightly colored tape on glass doors, large windows or glass furniture. No. For patients who wander, use locks on doors. These can be installed lower or higher than usual, so the patient will not use them. Install alarms that sound when exit doors are opened. Have patients wear identification (SEW) labels into clothes. Alert neighbors that the patient may wander. Show them a recent photo of the patient. Keep a recent photo handy, as well as a piece of clothing the patient has worn. These can help police and police dogs track the patient who has wandered away. No. Remove clutter and throw rugs. Do not rearrange furniture. Do not wax floors. Be sure shoes and slippers fit and have non-slip soles. For patients who pace, keep areas well lit, even at night. Block access to stairs with a gate. Clear walkways of electrical cords and clutter. For patients who have difficulty walking. General tips to ensure a safe environment for patients with Alzheimer's disease include the following. Keep medications and other chemicals out of reach. Post emergency numbers, including poison control and the home address somewhere where they can be easily seen. Use red tape around radiators or heating vents to prevent burns. Check refrigerator and hiding places for spoiled food. Prevent kitchen accidents by removing knobs on stove, unplugging toaster and other small appliances, and supervising kitchen visits. No. Although Alzheimer's disease cannot be cured, there are techniques, such as creative therapies, to improve the quality of life for patients who have Alzheimer's disease, and which also may help us provide good care. Validation therapy. Useful in cases of severe dementia. Helps to reorient the patient to actual circumstances. Provides comfort and may reduce agitation. For example, the patient tells his HA that he does not want to eat lunch today, because he is going out to a restaurant with his wife. The HA knows that his wife passed away several years ago. Instead of telling the patient that he is not going out to eat, the HA asks what restaurant he is going to and what he will order. The HA can also suggest that the patient eat a good lunch now, because sometimes the service is slow in restaurants. Alzheimer's disease. Reminiscence therapy. Useful in different stages of Alzheimer's disease. Encourages patients to talk about past experiences. Helps patients remember pleasant times and allows us to increase their understanding of patients. Activity therapy. Helpful throughout most stages of the disease. Uses activities the patient enjoys to prevent boredom and frustration, as well as promote self-esteem. HUS can help patients walk, do puzzles, listen to music, cook, read or do other activities the patients may enjoy. Alzheimer's disease. Below are some common difficult behaviors that home health aides may face when working with patients with Alzheimer's disease. Every patient is different, and HUS should work with each patient as an individual. 1. Agitation. A patient who is excited, Restless or troubled is said to be agitated. A trigger is a situation that leads to agitated behavior. Even watching TV can cause agitation, because a patient with Alzheimer's disease may lose the ability to distinguish fiction from reality. If a patient is agitated, the should try to eliminate triggers, keep a routine and avoid frustration. Redirecting the patient's attention may help. Reduce noise and distractions. Focusing on a familiar activity, such as sorting things or looking at pictures, may help. Remain calm and use a low, soothing voice to speak to and reassure the patient. When a patient with Alzheimer's disease gets agitated in the late afternoon, evening or night, it is called sundowning. The triggers may include fatigue, hunger, a change in the patient's routine, any new or frustrating situation. The should schedule essential activities and appointments early in the day. This will use up energy, reducing stress. Reduce activity and distractions toward the end of the day. Discourage evening visits and outings. Avoid overstimulation. Keep the patient well hydrated and provide snacks. Encourage an afternoon nap every day. This reduces fatigue and agitation. Set a bedtime routine for the patient and keep it. Engage the patient in a simple, calming activity like looking at a magazine. Playing soft music may help. Alzheimer's disease. 2. Violent behavior. A patient who attacks, hits or threatens someone is using violence. The triggers may include many situations, such as frustration, overstimulation or a change in the patient's routine, environment or caregiver. If a patient is violent, the should call for help if needed. Block blows but never hit back. Step out of reach and stay calm. Not leave the patient in the home alone. Try to remove triggers. Use the same technique to calm patients as for agitation. 3. Hallucinations or delusions. A patient who sees, hears, smells, tastes or feels things that are not there is having hallucinations. A patient who believes things that are not true is having delusions. If a patient is experiencing hallucinations and or delusions, the should ignore harmless hallucinations and delusions. Reassure the patient who becomes agitated or worried. Not argue with the patient who is imagining things, as these feelings are real to the patient. Redirect the patient's attention to other activities or thoughts. Alzheimer's disease. 4. Disruptiveness. Disruptive behavior is anything that disturbs others, such as yelling, banging on furniture and slamming doors. The triggers may include discomfort, pain, constipation, frustration or a wish for attention. To prevent or respond to disruptive behavior, the should be calm and friendly and try to find out why the behavior is occurring. Notice and praise improvements in the patient's behavior. Be sensitive and avoid treating the patient like a child. Tell the patient about any changes in schedules, routines or the environment in advance. Involving the patient in developing routine activities and schedules may help. Encourage the patient to join in independent activities that are safe. Help the patient find ways to cope. Focusing on activities the patient may still be able to do, such as knitting or crafts, can provide diversion. 5. Inappropriate behavior. Inappropriate behavior may include cursing, name-calling or yelling. The should try not to take it personally. Remain calm and be reassuring. Not overreact, as this may reinforce the inappropriate behavior. Report any physical abuse or serious verbal abuse to your supervisor. Alzheimer's disease. 6. Hiding, hoarding and rummaging. These common problems can be disturbing to caregivers the patient with Alzheimer's disease lives with. The should try these strategies. Lock doors and closets. Put a sign that says no on places you want to keep the patient out of, such as certain rooms, closets or drawers. Watch for patterns. If a patient keeps taking the same thing, give one of his or her own Do not leave things lying around in the open. Put things away neatly. Make duplicates of important items like keys and eyeglasses. Keep the patient's closet open, so he or she can see his or her things in plain view. When the patient can always see that he or she still has his or her everyday items, the patient may not feel the need to go looking for them. Designate an easily reached drawer as a rummage drawer. Fill it with interesting, harmless items like old keys and chains, trinkets or plastic kitchen implements. Allow the patient to rummage freely in this drawer. Look through waste cans when something is lost and before emptying them. Patients with Alzheimer's disease tend to have favorite hiding places for things. Look for patterns. Most behaviors have a reason. Look for the reason for the behavior before responding. Alzheimer's disease. 7. Confusion. Do not try to enter the patient's world by pretending to see or hear the things they seem to see or hear. Help the patient stay grounded in reality by using some of these techniques. Ask questions with yes/no answers. Make positive statements that let the patient know what you want. For example, say, "Stand still," instead of, "Don't move." Give the patient a limited number of choices. Lay out clothes in advance. Keep the wardrobe simple, and try these things. Avoid buttons and zippers if possible. Use Velcro fastenings and elastic waistbands. Limit the number of colors in the wardrobe. Eliminate accessories. Give simple, precise instructions. Reduce distractions during a task. Give only as much guidance as necessary. Say the patient's name and make eye contact to get his or her attention before touching him or her. Alzheimer's disease. (7) Confusion. Use memory aids, such as posting a list of the daily routine or putting up a large calendar and clock. Other aids include, put name tags on important objects. Use pictures to communicate if the patient does not understand words. Make memory books with pictures of important people and places. Post reminders about chores or safety measures. Put a sign that says no on things the patient should not touch. Paint the bathroom door a bright color and put a brightly colored seat cover on the toilet. These will remind the patient where to go. Reassure the patient if needed, but do not needlessly distract the patient who is doing a task. Each step of a process should be handled as a separate task. Instead of saying, "It's time for your bath," say, "Take off your shoes." That's good. Now take off your socks. Allow plenty of time for every task. If the patient cannot complete a task, praise the patient for what he or she has accomplished. Alzheimer's disease. 8. Wondering. First, find out if the patient needs something. Look for patterns in the wondering and possible reasons, such as time of day, hunger, thirst, boredom, restlessness, need to go to the bathroom, medication side effects, overstimulation, or looking for a lost item. Perhaps the patient is lost or has forgotten how to get somewhere. Help meet the patient's need and keep him or her safe by trying these things. Remind the patient to use the bathroom every 2 hours. Have healthy snacks and a pitcher of water readily available. Provide a quiet environment away from noise, distraction and glaring light. Provide a purposeful activity, such as folding clothes or dusting. Provide an outlet, such as a walk, a social activity, a memory book or classical music played through headphones. Keep lights on at night. Use alarms, bells or motion sensors. Bed alarms are flat strips laid under the sheets that sound when the patient gets up. Outside doors should have bells or alarms that sound when opened. Motion sensors can be used in hallways. If the patient is in a home or facility with stairs, porches or decks, child safety gates should be used to block these. 2 gates can be used for height. Use child-resistant locks on doors and windows. Put a black mat on the ground in front of outside doors. Patients with Alzheimer's disease often will not step into or over a black area. If possible, the patient should carry or wear some form of identification, such as an ID bracelet that looks like jewelry but is engraved with the patient's name, address and phone number. Educate neighbors on what to do if they find a wandering patient. Call the police if the patient wanders away. Alzheimer's disease. Alzheimer's disease progresses at a different rate with each patient. It is important to focus on things that the patient can still do and enjoy. All patients with Alzheimer's disease need unconditional love and constant reassurance from their caregivers and home health aides, no matter what stage of the disease they are in. You will recognize these signs in many patients with Alzheimer's disease. Increasing and persistent forgetfulness. Difficulty finding the right word. Loss of judgment. Difficulty performing familiar activities, such as brushing teeth or bathing. Personality changes, such as irritability, anxiety, pacing and restlessness. Depression. Depression may show itself in some of these ways: wandering. Anxiety that can be caused by noise, feeling rushed and by large groups. Weight loss. Sleep disturbance. Pacing and agitation. Agitation often is a symptom of underlying illness or pain. Medication can also cause agitation, as can changes in the environment. Cursing or threatening language. Disorientation, delusions or hallucinations. A patient with hallucinations sees, hears or feels things that are not there. A patient with delusions believes strongly in something that is not true, such as believing that he or she has been captured by enemies. Difficulties with abstract thinking or complex tasks. Balancing a checkbook, recognizing and understanding numbers, or reading may be impossible. Summary: caring for a patient with Alzheimer's disease. These suggestions will help us provide good care for patients with Alzheimer's disease. Structure. Serenity and stability reduce behavior problems. When the patient with Alzheimer's disease becomes upset, the ability to think clearly declines even more. Follow a regular daily routine. Plan the schedule to match the patient's normal, preferred routine. Find the best time of the day to do things, when the patient is most capable. Keep familiar objects and pictures around. Bathing. Some patients with Alzheimer's disease will not mind bathing. For others it is a confusing, frightening experience. Plan the bath close to the same time every day. Be patient and calm. Allow the patient to do as much of the bath as possible. Never leave the patient alone in the bath or shower. A shower or bath may not be necessary every day. Try a sponge or partial bath some days. Always follow directions in the patient's care plan. Dressing. Allow extra time, so the patient will not feel rushed. Encourage the patient to do as much of the dressing as possible. Summary: caring for a patient with Alzheimer's disease. These suggestions will help us provide good care for patients with Alzheimer's disease. Content: eating. Some patients will need encouragement to eat, while others will eat all the time. A quiet, calm atmosphere may help the client focus on the meal. Finger foods will help those who struggle with utensils. Incontinence. Set a routine for taking the patient to the bathroom, such as every 3 hours during the day. Do not wait for the patient to ask. Many patients with Alzheimer's disease experience incontinence as the disease progresses. Be understanding when accidents happen. Communication. When talking, stand where the patient can see you. Use simple sentences and speak slowly. Focus attention with gentle touching if permitted. Environment. Make the environment familiar and safe. Keep medicines and any potentially dangerous items out of reach. Exercise. This helps patients improve their motor skills, functional abilities, energy, circulation, mood, sleep and elimination. Avoid pushing the patient to exercise. Praise the patient and provide encouragement. Give simple instructions. Mild stretching exercises are good. Demonstrate how to tense and release muscle groups in sequence, keeping the order the same each time. Exercise or walk at the same time each day. A daily walk may reduce wandering. Night ritual. Behavior is often worse at night. Create a ritual that is calming. Soothing music is helpful for some. Leave a night light on to reduce confusion and restlessness. Summary: caring for a patient with Alzheimer's disease